Hi, I'm Dr. Robin Trotman, infectious disease doctor at CoxHealth in Springfield, and today I'm going to give you an update on what's happening with COVID-19 in our community and how it pertains to our dealings at CoxHealth. I want to highlight some of the successes and where we're headed as we go forward. So first, people need to know we're going to incrementally start to open things back up. We are opening up the hospital and the healthcare services. We want to deliver those procedures and medical services that we know are necessary. And as we open up our communities, we need to be mindful of where we've been and where we still have to go. So this position we're in right now is a luxury, I have to say. We've done the right things. We've enacted these social distancing and these stay-at-home orders, and we've really halted the progression of this disease, and we're in a great position right now to try to go into a long-term mitigation phase. But what we need to know is that this ability to open things up is contingent on our compliance with a few key items, and I'm going to talk about those in a bit. The solution to mitigating this and not ending up where we were a few months ago and having large-scale disease, sick people, and even people dying, the solution to this is not questionable. We know what works. This drastic social distancing and these stay-at-home practices have saved our communities. It has to work. If we looked at the trajectory of where the models would say that we would be, had we not put these in place, we would have far more sick people, we would have more deaths, and we wouldn't be in this position right now. So what I want people to know is that there is not a new treatment, there's no new vaccine. These are not the things that halted the progression of this pandemic. It's because of these massive social and behavioral changes that the curve is flattened, and now we're prepared. The community's prepared and the healthcare systems are prepared. But here's a few things that I want people to know that are keys to success in getting things back to normal and running again. The universal masking is something we're doing in the healthcare system. We call it universal source control, meaning healthcare workers will wear a mask at all time when they're around a patient or if they're in the public. This is key. I want the healthcare workers to know that we are now the potential source for our patients. We have to wear this mask when we're around other people, other healthcare workers, or around a patient. This is going to be key to preventing the pre-symptomatic or asymptomatic healthcare worker from transmitting disease. And as we open things up in the community, there's going to be a higher probability that one of us might be incubating disease during this period. As we relax the statewide shelter in place, it doesn't make us more safe. In fact, we're probably as or more vulnerable going forward. As individuals, more vulnerable to getting this infection as we relax these statewide and local restrictions. So I want people to understand that as we do relax some of these restrictions, we are just as vulnerable to the infection individually and to transmit it as we were 2 months ago. We've done an awesome job so far, but we need to keep our foot on the gas. We need to continue to be mindful of our 6-foot radius around us. We need to be mindful of staying home if they're sick. We need to notify our doctor if we're sick. If someone in our home becomes sick or someone you're around, you're going to want to be very mindful of that. You're going to keep your distance, and at the first onset of symptoms, you're going to notify your doctor. We're still going to be doing things like virtual visits. And I think there's also a part of this for the healthcare workers, ongoing education. We're all going to need to stay abreast to the developments around this virus. Patient education is key. If we're treating a patient who has a test, for instance, that's pending, we're going to make sure that those patients have the right information to stay safe at home, to keep their other people who are in their household safe. So it's incumbent on us to make sure our patients are informed and that the other healthcare workers are informed to prevent secondary infection. So as a status update with CoxHealth, let me tell you, in the last 2 weeks, we've seen a dramatic decrease in the number of our cases, the number of infections, number of hospitalized patients. We've had patients that have been on the ventilator and been discharged home and have recuperated. We've had patients donate plasma so that we can give this to critically ill patients in the future. We've obtained some capacity to do in-house testing, and that affords us the ability to test healthcare workers rapidly, to do outbreak investigations, to test certain patients before high-risk procedures, and it'll make our healthcare system a safer place when we have ongoing in-house testing. We have numerous policies in place that will be applicable over these next few months. They're applicable to all of our hospitals. These are there to keep healthcare workers safe and to make sure that our system's prepared. So policy development, procurement of resources like testing. We now have several testing platforms that are available. So you read a lot about testing availability. We have reference lab testing. The local health departments have adequate testing, and we have some capacity to do in-house testing right now. I would no longer call testing one of our major vulnerabilities. There have been a lot of questions about antibody testing. I get this question a lot. Antibody testing, there are four FDA-approved antibody tests right now, also called serology. Those are intended to measure the presence of antibody, meaning you've been exposed to COVID-19 and now you have immunity. We don't know how long this immunity lasts. We don't know if it's durable. We don't even know how protective or the presence of those antibodies, how strongly it inactivates virus. So right now, the antibody testing that people typically ask about, it's really reserved for epidemiology, which means we use those antibody tests to look at where the disease has been. So maybe we use it for contact tracings. We might use it for looking at pockets of communities to see where the disease has been. And it's really not for clinical use. It's also used to maybe have people return to work, things like that, if we know you have antibodies now. I can tell you that our PPE supply has been a full-time job for many of us. We're stocked, we're ready to go, we're stable. We're prepared for a surge of patients. Now the PPE could be anything from eye protection, mask, gowns. We have adequate supplies. We have adequate supplies to resume our normal procedures and operations. So we're stockpiling that. We have processes in place to reprocess types of masks, and I think that's no longer a vulnerability of ours. This preparation has not been a small undertaking. It's been a full-time job for multiple people, and it's dynamic. But I can tell you that were we to have a prolonged surge over months where we had lots of ICU and ventilated patients, then the PPE could become a vulnerability. But right now, I feel comfortable with where we are. Now, all of that being said, I can't overemphasize that this process of reopening our communities, returning our healthcare system back to normal operations, this is all contingent on meticulous attention to detail with our compliance with all of these practices. I know it's hard, but we have to continue to be diligent to conserve our masks, to be mindful of not wasting some of these supplies, and to use the testing appropriately. So finally, let's take a step back and let's look at where we've been for the last 2 months, and we'll make a few observations. First, I think about this massive amount of people around the world who, upon instruction, having never heard of the word social distancing, maybe even not knowing the word quarantine, but having heard these instructions, made enormous life changes. This is incredible to think about, people halting their life, their normal moving about the community. You have sacrificed, and we've all struggled together. So many people around the world have radically changed their behaviors overnight. And to some of these things, I never would have thought we would resort. I never thought we would be stockpiling medications and reprocessing masks, and people would be at home and schools would be canceled. But people have stepped up, and in an instant, they've risen to the occasion, and this is something that, to me, is very hopeful. I can see enormous hope and potential in our environment and our planet. We know that our planet and our environment, we've seen tangible benefits. I see this as hope going forward, and it's a result of this pause in our normalcy. Healthcare workers have become heroes in their communities, and this is something that gives all of us joy, is to see the humanity that's being bestowed upon healthcare workers and these brave people going in and working every day. And the public is in sheer appreciation of this. So to me, that's hopeful as well. I know that this is hard. We're seeing altruism and sharing, and we're seeing people compromise and sacrifice. And this is in light of an invisible enemy. So I know this is hard. It's going to be hard for this to be durable over time. But as a society, we're now able to see each other as cohabitants. People are looking at how wearing a mask affects somebody else rather than themselves. And this is a massive paradigm shift. Today, I believe we're now more able to improvise and unite. We're seeing people come together in communities. change their business strategies to adapt and provide services that they wouldn't have other provided. And what I think is interesting now is that human beings can change overnight. This is a capacity that we probably didn't know we were able to do. If somebody would have told us 2 months ago you'd be able to stay at home for 2 months and not go to a restaurant, who would have believed that? Yet our species, our humanity is very flexible and pliable, and this has been an interesting observation. I think we're much more adaptable than we could have ever anticipated, and I'm grateful to our community for making these sacrifices. It's what's giving us this opportunity to think about relaxing these restrictions today. So I express gratitude for people making these compromises and sacrifices. I know these sacrifices are real. There's been people sick, there have been people die, and it's a struggle. But we need to focus on our roles in managing this and going forward and recognizing our vulnerability. We're not less susceptible to this virus today, and many of the ways of us doing things in the past are going to have to radically change, and I think people are becoming mindful of that. And I'm encouraged by all of our abilities to adapt and sacrifice, like I said, and I'm certain that as we move forward that we're all going to be changed personally. Our healthcare systems are going to be changed, businesses are going to be changed, and in many aspects I think we're going to be changed for the better on the other end of this pandemic.